Can somebody, whether it's from the mayor, or representative, or the councilman, address the issue of trust, of what in your view has been a barrier so far, and how is it being addressed other than, the obvious outreach of an event like this?
I think when you begin talking about community partnerships, just to answer your question directly, there have been so many reports on what types of tests are out there, whether or not you need money or insurance. And so many of the folks in the community are really relying on the traditional way of communicating. That's picking up the phone, talking to your folks through your church networks, and really figuring out, okay, where do I go if I feel like I need a test? And so what's been happening throughout the city of Hartford is a lot of leveraging on existing efforts throughout this city. So there are food operations throughout the entire city of Hartford in partnership with the city and many churches who are feeding on a daily basis. Those very people who are coming to get their bellies filled with food are the very people who are saying, where do I go to get tested? Why? Because they trust the people who are feeding them. They're in the community, their faces in the community as well. As chair of the Black and Puerto Rican Caucus, we've talked a lot about how to elevate influencers throughout the state, right? So you need some more black and brown faces, not limited to, but black and brown faces who can speak directly to many of the families and young people throughout this state on the importance of getting tested. Whether you have symptoms or not, you should go get tested. So I would really underscore the importance of leveraging existing initiatives. Our federally qualified health centers, they're out there on the front line, and many people have a lot of trust in them, which is why it's important we provide funding from the federal and state level to support many of these institutions that have a direct connection to our communities.
Do we have a reason why Hartford has the second highest fatality rate? Do we have more comorbidities in Hartford?
So I don't know yet that anybody can answer that with full confidence, but if you look at the Hartford region, both the city and towns, particularly West Hartford and Bloomfield, there is a very high concentration of nursing homes. And we have been looking carefully at the data to try to understand those numbers. And I think, as you know, fatalities have been highest in our nursing homes. They've been hit hardest throughout the state. And given the very significant concentration of nursing homes here, I think that is a part of the fatality rate here. But as many others have said eloquently, it's also true that urban centers around the country and communities of color around the country have been hit hard for many reasons. You have more multi-generational living. You have more dense living, more apartments. You have more difficulty social distancing at home. You have a higher number of people who are in jobs that have been deemed essential to be on site. You have more folks who are working as first responders. And there's no question that you have the legacy of generations of health disparities and significantly higher pre-existing conditions, underlying health conditions that make folks more vulnerable. But again, I do think that a big part of that fatality rate is the concentration of nursing homes. And can I just speak real quick to the question that Paz asked also? I think when you hear from somebody, a government official, somebody like me, or from a hospital exec, that you're not going to have to pay, you're not going to get stuck with a bill, that there's not going to be some unintended consequence of getting a test, you might believe it. But if you hear it from the FQHC, where you get your primary health care, you may trust it in a different way. If you hear it, as Brandon said, from your pastor, or you hear it from a community organization that's out there delivering food, I think you may hear that in a different way. And I think that because so much of our promotion effort, including for this one, is based on those partnerships, we've been able to see some really successful results at the mobile testing. The testing that was done down at Phillips Church over the last couple of weeks drew about 300 people both days. The testing down at Batchelder last week drew 300 people. And that's because, in addition to the partnerships to administer the test, there were the partnerships of churches, of nonprofits, of community-based organizations getting out there and spreading the word. And that's the model that we're building on.
There's one other point which I think is very, very important here. I was standing in line yesterday down in New Haven, not standing in line, but talking to some of the folks in line, and it reinforced for me one of the concerns that is raised, which is privacy. A lot of folks are reluctant to get a test because they're not sure who's going to learn about it. Now, I was tested yesterday. I tested negative. I'm choosing to disclose that fact, but the results of that test were going to be made known only to me. People should know that this information is yours and yours alone. It doesn't go to your employer, doesn't go to your family, it goes only to you. And if you choose to tell anyone, that's your doing. But if your choice is to keep it private, you can keep it private. So this privacy issue, I think, is very important. I've heard a lot about it from folks, and I think they need to be reassured that no matter what the results, they will be private. As a matter of law, as a matter of federal law, as you know, they have to be kept private.
Thanks for all your questions.
Dr. Edie, I'm trying anyway. Are there any plans to set up mobile testing sites in Waterbury? I'm looking at the city of Waterbury's latest update from yesterday, and it says you still need to have a prescription from your doctor to get a test. We just heard the governor and the mayor talk about bringing testing, the importance of bringing testing to the community. What is Trinity's plans regarding Waterbury?
Yeah, so we treat all of our regions exactly the same, right? So you don't need a prescription to get tested at any of the Trinity Health New England facilities. So in Waterbury, as you're alluding to, is St. Mary's. Of course, here we have Mount Sinai and St. Francis, and we have Johnson in the Stafford Springs area. So no prescription is needed. And the reason why is because we provide the prescription for you. Because of our new virtual care operations, in real time, when a citizen shows up to a Trinity Health of New England testing site, we will virtually connect that person with the provider. The provider then provides the prescription, and then the testing is done. So this is seamlessly. This is asynchronous provisions when it comes to a test. We are in conversations now, so I am talking to Attorney Mullins about expanding this. And if for some reason there's restrictions with Charter Oaks, we will find another way to provide the mobile testing. But as you know, I mean, when you look at the complexity around this virus and compares to Waterbury in Hartford, there's a difference, right? And so we wanted to start here because we saw that it would have a greater impact. But our intentions are to expand it throughout the territories that we service.
Well, actually, there's only 360 more positive cases in Hartford than there are in Waterbury. According to yesterday, there were 1,833. So are you in discussions with the city of Waterbury? Are you in discussions with the Lamont administration about making arrangements to provide mobile testing in the city of Waterbury or not?
So when I say I'm in conversations, I'm speaking with Charter Oaks and their leadership team. So Attorney Mullins and I are in conversations. And I can get you an answer within the next 24 to 48 hours if that's what you're insisting on.
No, I mean, everybody's been talking here at this news conference about the importance about bringing testing to communities. And right now, there's only 2 drive-through testing sites in the 5th largest city of Connecticut. So I'm just wondering, what are the plans?
That's the plan.
And I can add as well that there are FQHCs in Waterbury. Staywell is one of them that is conducting testing as well. And the FQHCs are having conversations with the Department of Public Health and the Department of Social Services about broadcasting a statewide testing plan, utilizing all of the 17 FQHCs throughout the state, and Waterbury is on that list. And there's a call today at 11:30 to discuss that even further.
But there are no plans at this moment to establish mobile testing in Waterbury.
I'm not sure how many different ways to give you this answer. The answer is we are in the process of creating a strategy to provide mobile testing in Waterbury.
Dr. Edie, quick question, more logistical as this is starting to launch. You know, the thing that people are always concerned about is when they go to this, you know, Senator Blumenthal's point, they're standing in line. What are the measures that are going to be in place that when people are actually here and waiting? Because I'm sure now that all this news is out, people are going to be flocking to actually get tested. How are you guys going to make sure that people are staying safe while they are here, especially with such a large crowd?
Yeah, so I think the governor has given us clear guidance on how to demonstrate safety when in a public setting. So masking is going to be expected. Social distancing by at least 6 feet.
6 feet.
So we're going to follow the governor's recommendations. If you go to ct.gov, you can see what I'm alluding to, and it's very clear as to what his expectations are, and we've committed to complying to both the safety of the citizens of Connecticut and, of course, our governor.
Now just a few days away from the casinos planning to open their doors, where do your talks with them currently stand with the tribes?
Well, as you know, we've gone out and visited both Foxwoods and Mohegan Sun, our healthcare team, looked at some of the protocols they put in place. We've given them in written form some very specific suggestions that we think would, potentially save lives and up the healthcare protocols a lot. I saluted them. I said, look, you're a sovereign country. You've made that very clear. And you didn't have to, but back in March, a considerable financial hit to yourselves, you did close down those casinos. And here we are 2 months later. We have some of the lowest infection rates, not just in the state, but in the entire region in eastern Connecticut, in part thanks to the incredible sacrifice the tribes made. Obviously, you've heard from me. I think the idea of opening up on June 1st is early. It's earlier than Las Vegas. It's earlier than any of our regional casinos want to do. I'd like to have a little more time. Short of that, I'd like them to put in stricter protocols. I think that's key for the public health of customers going in, their employees, and the greater region.
What are the protocols you think needs to happen that need to be stricter?
I look at California. I see the tribes there voluntarily said we're not going to serve alcohol. You know, alcohol is not great for social distancing. You're taking off your mask. I thought that was a really important voluntary effort they made there. I see in Maryland, they've capped capacity at 30%, not just 30%, 30% of the part of the casino that's open. Make sure that that social distancing is very possible. I see Oneida up in upstate New York. They've limited the group of people that can go to that casino to say, I can't remember, maybe 50 miles in a circumference to make sure you're not attracting people from New York City and Boston to come to your casino. There's some things you could do that would make a big difference in terms of public health.
Governor Lamont, while you're up here, can you also talk about hair salons and barber shops? I know that their original opening date was a few weeks ago. We bumped it back. How are you feeling ahead of that reopening on Monday?
I know that a lot of the barbers, particularly the salons, particularly the stylists, said give us a little more time. We said 10 more days. We wanted to make that more or less coincident with Rhode Island and Massachusetts. They're pretty much on the same time frame. And I think they appreciate the time, and I think they're ready to open. And looking around here, I think there are a lot of people who are ready for them to open.
Related, so you said that all of the key metrics are moving in the right direction. The testing actually fell in the past week. Would you consider closing things back up if testing doesn't reach the benchmark you set previously? Would you consider holding off on the second phase if it doesn't reach 100,000 tests per week?
I would certainly take a look at that. I'm very confident. You know, thanks to the work of the people right here, not only do we have the capacity, but now we're going to be getting people in to test. It fell off a little bit over Memorial Day weekend for reasons you can probably understand. We're doing everything we can to ramp that up to 42,000 and beyond per week.
Governor, can you react to the Republican leader's call for a special session concerning the executive order?
You know, I say go for it. I don't think I call special sessions. I think they call special sessions, and when they feel comfortable coming in, that's certainly their right. If you did it through Zoom, makes a certain amount of sense to me, but that's their prerogative.
Do you think they should be taking actions either to amend the emergency declaration laws that would give the legislature more authority to respond to your executive orders, either to amend them or rescind them?
Or just give me a call. Tell me if there's an executive order you don't think is appropriate. Tell me what it is. I get mixed signals a little bit from the legislature. You maybe remember for every other day the Democrats in the Senate were saying you're opening up too fast, you're opening up too fast. And now with the tribes opening up, inside 65-year-olds drinking, I said any statement on that, and it's been crickets. So, but I'm happy to get any feedback I can from folks who have some input.
Well, doesn't the legislature have the authority to call itself into session and take any action it wants regarding any sort of order that you made? I mean, don't
Well,
they have
certainly
that?
the first
that
part, they
option
have the
now?
right to go back into session anytime they want to. From there, let me ask Bob Clark.
Governor, you look at what you need legislative action as far as keeping some of your executive orders in force past September 9th when the public emergency expires.
The only thing I care about, I think, in terms of what we can't do after September 9th is voting. I mean, I would like to see absentee balloting available in November, not just for our August primary, and I'm told I can't do that unless the legislature steps in and takes the lead on that, and I strongly urge they do. Otherwise, you're right, Paz, all of our other executive orders come off at the end of that 6-month period, I guess that is, and that's probably appropriate.
Well, but I'm not saying they're going to do it, but theoretically, the Hartford Yard Goats on September 10th, if baseball wanted to, they could try to have 7,000 people at the ballpark, at the XL Center. We could have hockey, we could have concerts at 10,000, 15,000. So is that a concern after some period after September 9th, having the ability to sort of hold off on events beyond the 100 that I think is in the fourth phase?
Hey, that September 10th is a long way away, and I can't tell you what the world's going to look like. Look at how it changed in the last 30, 60 days. As Paul said, look, maybe the legislature has strong feelings. They'd like to step in at that point. And, or maybe they'd say, Governor, I think you've done okay. I'll see. And, we'd like to continue this a little bit further because you're putting public health first, not politics, when it comes to these protocols. That's a long way away. I'm going to worry about that later.
Going back to hair salons and barber shops, you were saying that you appreciate that people were asking for more time. What would you actually say to those salon owners? Because we've heard from many of them that felt like this really made things even tougher for them. I know that there were protests about it. What would you say to them today?
I'd say it's in 3 days you'll be opening up along with our neighbors in the regional other states, not counting New York. New York has kept everything closed down. I know you put in some money hoping to get the barriers and things you needed to do it safely on May 20th. It's just as relevant on June 1st. That investment was well taken. You're keeping your people safe, and customers are going to come in now because they know it's safe. Thanks, everybody.
Thank you, Governor.
Thank you.